Moving on a bit into sort of women's lives as they get older and thinking about the menopause now. So we do hear from people that sort of think they're in the sort of perimenopause phase. So they're having these symptoms, but quite often they might overlap with MS symptoms as well. So it can be confusing trying to work out what's going on. So how can you sort of tell the difference between what's MS and what's menopause symptoms, and how can people get support for this?
It's really hard. So if you're finding it hard, I suppose I don't know if it's reassuring or not, but one of the things to say is that you're not alone in finding sort of trying to ascribe that hard. So many people do. And it can be impossible, and it can, quite commonly it can be both. Um, what I would say is sometimes we end up doing something pretty pragmatic and saying, well, let's treat it as if it's one of these,
Mm,
see what happens. Does it get better? Yes or no? If it doesn't, well, okay, that treatment's not worked. Let's try treating the other one. Um, because so many of the symptoms, so fatigue, poor sleep, cognitive fog, urinary and bladder symptoms, sexual dysfunction,
mm,
they're common to both. You see them both in MS and menopause, and you can see that the symptoms can be essentially indistinguishable. So it is often a case of trying to treat one, seeing what happens. One of the things that I would say, particularly if you're female and you think you are perimenopausal, is that often menopausal symptoms are easier to treat than MS symptoms. Um, and so with topical hormones, with HRT, with sort of, you know, again, similar to many other the other things I've talked about today, that HRT approaches have become much more complex and much more targeted. Um, Whereas often with some of the symptomatic treatments that we use in MS, they're actually a bit less effective. They work, you know, they can work, but they may well not work. Whereas HRT, the treatments tend to be pretty effective. So particularly if somebody's having other perimenopausal symptoms, I'd be tempted to go in with hormonal therapies first off for those some of those shared treatments to see what impact they have.